Guys, I'm shocked. I had no idea this particular food could help with ED. I'm Jake Bronstein, head of marketing for UB Health, the only doctor-approved medical-grade AI symptom checker, and we're going to talk about this specific food ingredient that may help with erectile function. Foods containing this ingredient have been shown in some studies to help with other urologic issues too, like BPH or an enlarged prostate. I've noticed that the doctors on our team often tell patients, if you enjoy it and have a large prostate, consider including it in your diet. There's even some potential prostate cancer prevention benefit, or at least a reduction in PSA values, which are the blood tests we use to screen for prostate cancer. However, the data on that is not particularly consistent. But what I was amazed to find out is that it might also benefit men with erectile dysfunction. How did I find this out? I read a 2023 study where researchers analyzed data from the NHANES database. That's a nationally representative cross-sectional survey of the U.S. population. Basically, they survey a group of people that reflect the general public. In this study, they looked at 3,200 men who reported how much of this food group they consumed and whether or not they had ED. The participants were divided into 3 groups, or tertiles, based on their intake, lowest, middle, and highest. The average intake was about 6.9 milligrams of the active ingredient. What they found was pretty wild. Men who consumed more of these foods were less likely to have ED. Specifically, moving from low to middle to high intake was associated with a roughly 30% drop in the odds of having ED. And this held true even after accounting for other factors like age, weight, smoking habits, and other health conditions. To strengthen the results, the researchers used a technique called propensity score matching, which helps balance out differences between groups. In this case, men with ED and men without it. After matching, they ended up with 677 men in each group. The results still showed that lower intake was linked to a higher risk of ED. They also looked at different subgroups, by ethnicity, weight, and other conditions. The link between higher intake and lower ED risk was especially strong in Mexican-American men, non-Hispanic white men, men with a BMI under 25, men with high blood pressure but no diabetes, and men who didn't smoke. That makes sense, since diabetes and smoking both heavily affect erectile function. Now, while this study suggests a strong link, it's important to remember that correlation doesn't mean causation. Just because we see a connection doesn't mean that eating this food directly reduces ED. So what is this food? It's lycopene. Lycopene is a carotenoid, a pigment that gives fruits and vegetables their reddish or pinkish color. Think tomatoes, watermelon, pink grapefruit, all packed with lycopene. Lycopene is a powerful antioxidant, meaning it protects your cells from damage caused by free radicals. That's where most of the health benefits come from. Back to the study, they also looked at lycopene as a continuous variable. That means they examined how risk changes as lycopene intake increases milligram by milligram. And the results were clear. Between 0 and 20 milligrams of lycopene, the risk of ED dropped fast. Most studies suggest 6 to 12 milligrams per day is the sweet spot. To get that, you can try 1-2 cup of tomato sauce, plus 1 cup of tomato soup, plus 1 cup of tomato juice, plus 1 cup of watermelon, plus 1-2 a pink grapefruit, plus 2 tablespoons of tomato paste, plus 1 small papaya. Bonus tip: cooking tomatoes, like in tomato paste or sauce, increases how much lycopene your body absorbs. So go ahead and load up that pasta. Did you know that in my culture, South Asian culture, particularly North Indian food, almost all our curries are made with tomato paste or tomato sauce as a base? I wonder if that has something to do with the traditional anti-inflammatory benefits we associate with ingredients like turmeric and garlic too. It might be helpful to explore the ethnic foods you already enjoy. A lot of them already include ingredients with major health benefits like lycopene. Bottom line, if you enjoy lycopene-rich foods, incorporating them into your diet might reduce your risk of ED, an enlarged prostate, and maybe even prostate cancer. Before you go, one important announcement. If you're worried about your health or wellness, please be sure to check out the UB AI Symptom Checker at ubhealth.com. Its doctor-approved, medical-grade AI is like having an on-call medical team right in your pocket. Best of all, it's 100% free, always.